Freezing is a common problem in Parkinson's disease that has been present for 10, 15, 20 years. And in this phenomena, the feet seem to stick to the floor. And that may happen as somebody starts to walk. Very commonly it occurs as people try to pass through doorways, and it often commonly occurs as people try to turn. So what are the things that will help with freezing? One of them is the person often knows things that help and things that will hinder. So if you are a caregiver, the person may tell you, don't talk to me and don't stand in front of me or next to me while I'm walking, because I find that distracts me. Other people find that for the patient to put their arm on the caregiver's arm will actually help. What about when people actually freeze? What are things that will help them get out of the freeze or break the freeze? One of them is to look at a target on the floor. And I actually had a patient who would carry little wads of paper in his pocket. He'd reach in, grab them out, drop them on the floor in front of him, and try and step on them. Some people like a laser pointer, and they can point at the floor and try and step on the laser beam, and this will get them going. Another trick is to step sideways and then try to step forward. And if people are really stuck, sometimes the caregiver can stand behind them and gently rock them from side to side and rock them, say, to the left and give them the instruction, now step with your right leg. Another trick that often works is for the caregiver to put their foot sideways right in front of the person's foot that has the Parkinson's disease and is frozen, and tell them to step over their foot, over the caregiver's foot. And that will often break a freeze as well. None of these tricks works all the time, but having a number of these different tricks often is really helpful. So if one doesn't work, you can switch and try another trick. Another tip for freezing is based on the fact that many people, in fact the most common situation in which people freeze is trying to turn. And people with Parkinson's disease try to turn in one place. They're trying to do what we call a pivot turn without just turning in place, which is the kind of turn that we've done all our lives with no problem. And avoiding a pivot turn actually will avoid freezing. And the way to do that is to walk around the turn. So instead of just turning in place, you have the person walk around a turn like this. And that will often prevent the freezing and also will help prevent falls that occur with turning. So no pivot turns, and walking out the turn where the turn is broader makes it much easier for people and prevents freezing and falls.